welcome to this edition of Inkboard Today. My name is Mike Moran. I'm pleased to be your host. This is a recurrent program that highlights the services available to residents of Southern Kane County and surrounding communities. In this program, we look at the organizations that provide valuable assistance to these residents. So today we will be learning more about Senior Services Associates. And with that, I'd like to welcome today's guest, Amy Cummings, who is the Senior Companion Coordinator for the organization. Welcome, Amy. Tell us a little bit about yourself.
Hi, well, thank you. I have a degree in therapeutic recreation from Grand Valley State University, and I have worked in nursing homes as discharge planning, helping them get what they need to go into the community. I've also worked as an activity director, enriching their lives right there in the nursing home with the different activities. And then in 2014, I was hired here by Senior Services as a care coordinator. And as a care coordinator, I also did home visits and made sure that the seniors had what they needed to live independently as possible in their own homes. And then just recently, they asked me to take on the role as a senior companion coordinator, which with my background, I have the tools to do that, to identify their interests and help match the volunteers to help enhance their lives as well.
And so it sounds like before you got to Senior Services Associate, was most of your career working with seniors or with elderly? I'm not sure what the right term is.
Correct.
Okay,
correct.
Okay.
Yep.
And in terms of pursuing that as a profession, was there any particular reason why you pursued working with the elderly as a professional pursuit?
When I was in college, I did several different internships and volunteer opportunities, and seniors just seemed to be my niche.
Good.
So, yeah.
And growing population too, which services are much more important. Okay,
Absolutely.
Good. So that's a little bit about yourself, but people probably don't know much about Senior Services Associates. And so obviously our intent today is to learn as much as we can about that organization. So tell us a little bit about Senior Services Associates, their history, where they're located, what you do as an organization.
Okay. Senior Services began in 1973 in Elgin. It was just in one small community. Later on, it also received the CCU through the state of Illinois, and so that was when they were in Kane and Kendall County, and then later McHenry County joined them. We do a little bit of everything. We have information and assistance programs that helps the people in the community get what they need to remain in the community longer. We've got care coordination, there's ombudsman programs, there's adult protective services, of course there's activities, we have transportation, there's a lot of programs that Senior Services offers.
And as you mentioned, so I heard you mention, I think Kane County, Kendall County, and also McHenry County?
And McHenry County, yes.
Okay, so you provide services to people who reside in any one of those three counties?
Correct.
And
correct.
multiple services across. How many locations, how many sites does Senior Services?
We have 5.
5 sites? Okay. I know there's one in Elgin, apparently,
Correct.
which is the original site. Where else are you located today?
We also have one in Yorkville, Kendall County in Yorkville, and then we just relocated our Aurora office in Southern Kane County that is located on Plum Street. And we also have one up in McHenry and Crystal Lake.
Okay, so pretty spread out. So really
Yes.
trying to give people access across your whole service area.
Correct.
Okay.
Correct.
And you mentioned a CCU, so at some point, each community will have an organization similar to Senior Services Associates to provide need for senior citizens?
Yes. The Department on Aging, they contract with us to provide these services. And each community has a CCU. So we are the lucky ones for this particular county.
And I was listening as you went down the list of the services and the programs that are available through Senior Services Associates. I believe one of the ones was information and assistance. So tell folks a little bit about that. What does that entail? What is the information and assistance program?
Information assistance program is very important. It is an opportunity for the seniors to come in and talk with someone to find out what's available in the community to help them. Some of the things they help with is license plate discounts. They assist with Medicare and Medicaid type things. During Part D enrollment, they're very busy. They assist with heating and cooling assistance for some of those who need that, housing assistance. Housing is something there's not a whole lot of for seniors. They really help people find what is out there, what they what they need to help them stay in their homes as long as possible. That's really the goal.
Okay.
Let's help them do
And
that.
so for many folks, they may not know all the different programs that might be available, so your information assistance program is really sort of the one place where they can go and ask questions, and you guys can point them in the right direction, share valuable information about benefits and how to access those and those sorts of things.
Absolutely. Information and assistance is the very first place people should start.
Okay, okay. And then I know specifically in your introduction, you talked about your role as Senior Companion Coordinator, and that's part of a Senior Companion program. So tell folks a little bit about that. You're obviously very much involved with that. So tell us about that Senior Companion program.
So the Senior Companion program is basically a friendship matchmaking service, is what I like to call it.
Yeah.
I bring seniors and volunteers together, hopefully to form lifelong friendships. And I do that with doing interviews, finding out what their likes and dislikes are, what kind of things they like to do, if they like to go out, if they don't like to go out, if they're hard of hearing and they need someone who speaks clear. I do what I can to find just the right match for them.
And you talked about sort of matching people, and so you use volunteers is apparently an essential part of that program. But I'm curious, so for that program, does it help break down isolation? I heard you matching people, so is it really a way to keep people connected?
Yes, absolutely. Definitely helps the at-risk senior that's isolated in their home. Maybe they only receive phone calls from their kids or visits on the weekends. Sometimes that's just not enough.
Okay.
And the volunteer comes typically once a week, so it is another well-being check to make sure they're doing okay. They're able to see, after they've been with each other for a while, they're able to see the changes, and then they are able to alert myself, and then I talk to their care coordinators, et cetera, to help them get the services that they need.
Okay, so it really breaks down that isolation and helps people stay connected not only to other people, but to other parts of the community and those sorts of things and that. So,
absolutely.
In terms of that specific program, do you know how, across all of your sites, roughly how many seniors are involved with that program at any one time?
I would say probably across each site, there's probably about 50 seniors,
okay, so that's
give or take.
Quite a significant number and things like that. And do seniors move into and out of that program? Might they be part of it for a short while and then they may no longer need those services, or?
We typically try to ask the volunteers to give us a year. We ask that for the senior as well, because it's not just for the senior. The volunteer is getting something out of the program as well.
Okay.
So they can come in and out of the program. It's not for everybody.
Okay.
I do usually tell people, give it a couple weeks. And if it's not the right match, then let's just try to find somebody else.
Okay. And how do you recruit volunteers? So since volunteers play a key role, tell us a little bit about that process.
Okay, that is definitely a process. Our RSVP, our retired senior volunteer coordinator, she also helps find volunteers. I've recruited at churches. I just did a talk at the Sugar Grove Senior Luncheon, trying to recruit, because I see these people are out in the community, they're driving. They hopefully would be able to go to someone's house. And
do you look for, with volunteers, you look for any specific commitment from them? Is there training required? If I wanted to become a volunteer, what would I need to do? And how would I qualify to be a volunteer?
Okay, so you need to be 18 years of age or older, first and foremost. I would do an interview with you, going through your likes and dislikes, and just make sure you have the driver's license, you have the background check. We make sure that you have car insurance. And the commitment, we try to get people to do 1 hour once a week for a year.
And it's typically just one volunteer per participant. So
typically,
if I were a volunteer, I'd have one person that I'd be working with and getting to know and those sorts of things.
Correct, unless you have lots of time on your hands and you want to have more than one.
Yeah, okay. So there's opportunities and things
there
like
is,
that?
Absolutely.
So, Later in the broadcast, we're going to talk a little bit about how people can contact Senior Services Associates. So at some point, you'll be able to give out the website and some information to help people do that. So in terms of that specific program, back to the Senior Companion program, we're going to have to pick up and wrap up that conversation. I know you have many other services that the agency offers, but we need to take a break right now. So when we get back from our break, we'll wrap up our discussion in terms of the Senior Companion program, then we'll talk about the other services available through Senior Services Associates.
We try to hide our truths about our mental and substance use disorders from the world, and sometimes from ourselves. Saying I'm fine is a facade. By facing our problems, recovery begins. And we are empowered to speak our truth. Join the Voices for Recovery. Speak up. Reach out.
Okay, well, welcome back, and we will continue our conversation with Amy. So, again, right before the break, we were talking a little bit about the Senior Companion Program. One question that I didn't ask you is, what do I need to do to qualify for that program? What are the criteria that I would need to meet to be a senior participating in that program?
So you do need to be 60 years of age or older. Typically, it is people who live in a home alone by themselves, maybe an apartment building that maybe doesn't have activities. And then I will come out and do an assessment to make sure that it's a program for you. It's not for everybody.
Okay.
You do need to be able to do a give and take with the volunteer, so the volunteer gets something out of it too. No one wants to go and visit someone who just sits there and doesn't say anything back. But we go through the likes and dislikes. Sometimes family members think that it's, oh, my mom needs this, my dad needs this. They don't want it.
Okay, sure.
They're like, hey, I'm fine. I've got this friend coming, that friend coming. I don't need this. Sometimes they have different expectations. Sometimes they think that I'm going to help them find somebody to go on a date with.
Okay.
Or they think that I'm going to help them find someone to run errands for them. That's not what the program's about. It's about friendship, it's about socialization. Yes, there are opportunities to go out together for movies or to meals, whatever they want to do together. But it's supposed to be a give and take, and the interest should be the same.
And it's great. It's great to hear you talk a little bit about. So it really is a relationship, and so it is something that clearly is meant to benefit the senior, but it really benefits the volunteer as well. So it's really the development of a relationship that becomes meaningful to both people involved and things like that. So
Absolutely.
yeah.
Absolutely.
Okay. Anything else about that? I know you had listed other programs, so I don't want to just focus on the Senior Companion Program. Anything else we need to know before we try to talk about the rest of your programs?
To be a volunteer, though, you do need to be 18 years of age or older. I can't if I covered that already or not. You do need to have a background check done. I'm not going to send anybody into a senior's house that I don't feel comfortable sending into my own parents' home.
Yeah.
Then they do need to understand that it is going to be a commitment. The senior has to understand that it's going to be a commitment as well.
So there's some screening done ahead of time to
Correct.
make sure it's a safe relationship and a good relationship.
Correct.
And then some support to help develop the relationship and
Correct.
become really healthy for both the senior and for the volunteer as well. Yeah, very, very exciting.
And I do always tell people, give it a couple weeks. If it doesn't work out, we can find somebody else.
Okay.
There are always other people out there. But we do need volunteers. We definitely do need volunteers.
Okay. So let's talk about some of the other programs that you introduced in the first segment. And one of the programs that I think you talked about was recreational services and education recreation. So can you tell us a little bit about those services?
So each center has their own activity department. And each activity director, she plans and organizes programs that are appropriate for that particular area. Each area has a little bit different culture or different needs, I guess I could say. Of course, there's always bingo pretty much anywhere you go.
Okay.
There's different outings. There is card clubs that they do. Each group always has some type of a celebration for the different holidays that come up. They also have exercise programs, which is very important. There's a program called Matter of Balance, which also helps seniors help for fall prevention, that kind of thing. They bring in rules of the road for those who are still trying to drive. That's kind of an important thing.
Yeah, sure.
Because after a while, you do kind of forget some of these things, and they do change the rules. Let's see what else they do. They also have different speakers that come in. There's a couple pharmacies that will come in and do flu shots, pneumonia shots. There's just a lot going on at the senior centers.
So if I were a senior, it sounds like if I was participating in the Senior Companion Program, I could then also be active with some of the activity programs you just discussed, and so I really could have involvement across a number of programs offered through Senior Services Associates and those sorts of things.
Absolutely. So, ideally, it would even be nice if some of them are able to take the senior that is not able to drive and get out and bring them to the activity program. Sure. Some of the centers also have lunch a couple times a week, so they're getting a good nutritious lunch, which is also very good for people.
So really an emphasis on overall health. So
Absolutely.
nutrition and social connectedness and relationships and balance and maintaining your driver's license and
Yes.
resources and those sorts of things. So
Yes.
So and again, every site has its own person who oversees those activities.
Correct.
So no matter where you live, if you're being served by Senior Services Associates, somebody's going to be able to help connect you to the things right there.
Absolutely. The first step would definitely be to give them a call
Okay.
and become a member, because then you also receive a newspaper every couple of months that tells you exactly what's going on.
Okay.
Gives you the calendar, it gives you the lunch menu, it tells you about the outings, if there's any type of special fundraisers coming up. And it's not too expensive,
Okay.
but that's a very important.
So as I understand it, certainly here in the U.S., we're seeing an increasing percentage of people who fall into that age category. So that then suggests to me that some of the people who might be accessing services might not only be elderly, but they may also be veterans. So are there specific either services or programs for veterans that are available through Senior Services Associates?
Nothing absolutely specific per se. We're fortunate enough in this community to have the Veterans Assistance Commission, and they are a wonderful group, and I always refer people to them. They know the benefits, they know the system. If there is something that veteran or their family is eligible for, they'll help them find it. They'll help them get involved in the VA system, the actual health and wellness system as well.
So if I were a senior and a vet, I could access all the services if I qualify
Right.
of Senior Services Associate.
Correct.
You would also, if I hadn't yet been linked to like the Veterans Assistance Commission, also work collaboratively with them so that I could access all the services and programs that would be beneficial to me.
Correct,
So,
correct,
okay.
yeah.
So earlier in the broadcast, you talked about the number of sites across the 3 different counties at various locations. And so a question that occurs to me, that's a huge geographic area. And so, transportation, access to services, tell us a little bit about, is that an issue and are there services available through the organization that help address that?
Transportation can be an issue at this particular age, as people are not able to drive as much, their families are working. This particular generation doesn't want to be a bother, and so they don't ask quite a bit. There are buses, like Kendall County has the Kendall County Transit, Kane County has the Ride and Kane. They have the different bus systems. But as far as getting to medical appointments and whatnot, that's definitely a problem for seniors. We do have a transportation coordinator, and he is able to help people get rides to these appointments based on if he has the volunteers available.
Okay.
The benefit to having one of his drivers do it is they do wait with the senior at their appointment, so they don't have to wait for the bus to come back. 9 times out of 10, their car is a little bit smoother to ride. If you're in pain, sometimes the bus cannot be the most comfortable. But at the same token, if you can take the bus, you definitely should to utilize the bus system. But we do have the transportation available, and we always need volunteers. So please, if you're thinking about
Okay.
volunteering, that's an excellent way to do it.
So one of the ways, if I was interested in supporting, as a volunteer, different programs from the organization, so one potential role would be to be a transportation volunteer. So I may have the ability to help people get to places that they need to get to and things like that. As you were talking a little bit about that, so depending on the person's ability, mobility, those sorts of things, for some people buses may be both accessible and appropriate, but when people have other transportation challenges, then you guys would work with them to try to make sure they could get back and forth to wherever they needed to be, those kinds of things.
We do the best we can, absolutely.
yeah,
Do
okay.
the best we can.
Okay. And you mentioned, as you discussed transportation, you mentioned volunteers. I know earlier when we were talking about the Senior Companion Program, you mentioned volunteers. Obviously, we've been talking a little bit about programs and services. One of the things that I haven't asked you yet is, so where would I go to find information? Is there a phone number? Is there a website? If I'm hearing this broadcast and saying, I'd really like to know more about what they do, I'd like to volunteer, where would I go for that information?
So the website would be a good place to start, and that is www.seniorservices, with an S on the end, ASSOC.org. Okay, and you can also call the Kane County office at 630-897-4035. And then the Kendall County office, that's basically where a lot of the transportation is based out of, That would be the 630-553-5777.
Okay, great. Well, thanks. And we're at the point where we're going to take one more break before we come back for our final session. We've talked a lot about programs and services, about serving seniors themselves. We actually haven't talked as much, perhaps, about caregivers and family members. So when we come back from break, we'll talk a little bit more about the programs and services, as well as meeting the needs of family members and caregivers. So thanks for being here. We'll see you shortly.
Recovery benefits everyone.
I started my own company.
I got my dad back.
My friends believe in me. Daddy's home.
Substance use and mental disorders can be treated. It all starts on day one. Join the Voices for Recovery.
Okay, welcome back as we enter our third and final segment of today's show. Again, we've been talking with Amy Cummings, who's a senior coordinator for Senior Services Associates. And so we've talked about most of the programs, I think, now, but there were two in particular, which were, I think, Adult Protective Services, as well as the Ombudsman program that I actually didn't ask you about. So can you tell us more about those programs now?
Absolutely. The Ombudsman program is more for the seniors in the nursing facilities. Sometimes you need someone to be on your side. Sometimes you need an advocate. If somebody is not agreeing with how they're being treated or what their treatment plan is or whatever, that's when they would call the ombudsman, and they kind of help work through that with the resident and the nursing facility.
So it really becomes their advocate between and works with them and the nursing facility to make sure that they're receiving appropriate care and resolving any issues or concerns or those kinds of things.
Absolutely.
Okay,
Yep.
but that is specifically to people who are in nursing homes or care facilities.
Correct. Care
Okay.
facilities, yes.
Okay.
The Adult Protective Service, that's a little bit more in depth. With Adult Protective Services, their role is to investigate allegations of abuse, neglect, exploitation. Financial exploitation is kind of a big thing recently. So somebody would call in, they would give us the report, and we would pass it to that department, and they review all the information, and then they take the appropriate action. I know some people don't like to put in a report. They think they're going to get someone in trouble. That's not the case. These staff members, they go out and they do their investigation. Sometimes the caregiver just needs some extra help, and they don't know that there's help out there. They're just getting stressed to the max, and that's when things happen. Self-neglect is another thing with hoarding, so we try to help people with that as well. But our Adult Protective Service staff, they're excellent at doing the investigations and helping with the needs of the community.
So that's really, it's not restricted to people who are, quote, in care facilities or nursing homes. So
No, that's
Adult
in the
Protective
community.
Services is for anybody who qualifies and concerns about their safety, well-being, those kinds of issues.
Correct.
Okay.
Correct.
Okay.
Yep.
And I know you mentioned, perhaps on some level, I do want to talk about caregivers, because obviously it sounds like in general for many older adults, elderly who qualify or seniors who qualify for the services, there's family members, and they may be in the role of caretakers, and there may be other people. So what does the organization do for the caretakers? How do you support people who are caring for someone who needs these services?
Caregiver support is very important. Right now we have quite a few people that are in that sandwich generation where they're still raising their kids, and then they have their parents that they need to take care for as well. And so it does get stressful. That is why we do have the caregiver counseling. Our Aurora office has some staff members who do the caregiver counseling there. There is also the Aurora family counseling. And if appropriate, if the senior really cannot get out, they can come to the home if they need to. Okay. Kendall County has the health department, and they have a staff there that also does counseling. And if appropriate, I believe they do also come to the home if they need to. But it's an opportunity for these caregivers to just to vent, to find out that they're doing okay, to get the tools that they need to continue. We also do have a respite program, which is it's as needed. It's a grant program, so the money has to be available. And the care coordinator would come out and do an assessment first to see if the senior and the family would qualify for the program. And then the family would look for either somebody they want to take care of the family, or we would help them find an agency, and then we'd help them pay for it. because the caregivers need a respite.
So it's really kind of a relief for the caregivers. So if
Absolutely.
you're in that role, and if you qualify, there might be some funding to help support a relief worker, a respite worker who could come and give you a little bit of a break
Correct.
at certain times of the day or the week or those sorts of things. So.
I've seen families utilize the respite services for weddings. Maybe they don't want to take their parent or their loved one to a family wedding out of the state. It's just not feasible. So then they hire somebody to come in and we help them with that. Or they take them to a facility. Sometimes that's an option too.
Okay. And so really from an organizational perspective, so Senior Services Associates, you work with seniors themselves, but you also work with caregivers and family members, so you're really pretty comprehensive about
Correct.
addressing the needs of the seniors that you're working with and those sorts of things. So, okay. As you talked a little bit earlier about the services for caregivers, you talked a little bit about mental health needs. I heard you mention hoarding, for example, and the idea of organization. So tell me a little bit about how Senior Services Associates addresses mental health needs of elderly who need it, of seniors who need it.
We do quite a bit of referrals to mental health, like the Aurora Family Counseling, of course, and then there's also the Kendall County Health Department. We do refer to them. There are other organizations, that they can also get the mental health from. But it's encouraging them to come to the activities. The socialization a lot of times will definitely help with mental health. If they qualify and we're able to do that, they also could get a caregiver to come into the home. Sometimes you just need a little help to get up in the morning or to organize your home or to, whatever you need to do to make yourself feel better. And
so it sounds like if I was involved with services through Senior Service Associates, if there was a concern about my mental health, you wouldn't specifically address it among your staff, but you have referral relationships to get services brought in that could help assess for and then address my mental health needs and those sorts of things. But at the same time, by breaking down isolation, by keeping people socially connected, that goes a long way to support really the needs of keeping everybody, but including seniors, psychologically, socially, emotionally healthy, those kinds of things.
Absolutely.
So, yeah.
And that's where the senior companion that we talked about earlier comes into play as well.
Okay.
Having extra people coming in to check on them, to make sure they're doing all right, and to give them that extra socialization, help them get out of the home. Some people need home delivered meals. We also are able to refer people to the home delivery meal program, and that's another avenue of people getting a well-being check and being checked in too.
Okay.
So, yeah.
And one of the programs you mentioned earlier, you talked a little bit about it being a grant-funded program.
Correct.
And so we really haven't asked you yet. So how are the services at Senior Services Associates funded? Who provides the funding for what people need?
So our funding comes from quite a few different sources. We have the state, local, federal funds. We have grants that we apply for. We do a lot of fundraising. And then we rely on donations. We rely heavily on donations. That's just what we need.
Okay.
Donate your time, donate your money, donate your
So
resources.
donations can come in many
Donations.
forms. It can be financial, but it can be time, it can be other talents.
It could be equipment when you're getting ready to, somebody no longer needs equipment.
Okay.
We have lending closets that we help out.
Okay.
Those who need equipment and
Okay.
can't afford it.
And obviously, part of your being on the program today is your relationship back to the Inc. Board, and so I know they're one of the local funding sources as well.
Yes,
So
yes.
they really support meeting the needs of people in the Southern Kane County and surrounding communities and those sorts of things. So if you were to look ahead, if you had a crystal ball and kind of looked at, if you had the chance to either expand or to offer services that aren't currently available, what would you expect? What would you project for the future? What are some of the needs for Senior Services Associates?
I definitely see transportation, as I said before. It's just that's my thing. More transportation, more people bringing people to where they need to go, a better system. But also just catering the activities to the growing changes of the senior population.
Okay.
As people our age get up there, we're going to have different needs. Maybe we aren't going to want to play bingo or pinochle. Maybe we're going to want something a little more.
Okay. Yeah.
Just the changing of the interests.
And I'm trying to think back to we started our conversation about people accessing services and getting hold of the organization. So as we get ready to wrap up this show, one more time, if people are interested in either volunteering, donating, accessing services, where would they go to learn more about Senior Services Associates?
They would go to our website, www.seniorservicesassociates.org. And they would also give us a call at Yorkville office at 630-553-5444. 630-897-5777, or the Aurora office, if you're in Southern Kane County, 630-897-4035.
Thanks so much. I'm sure
you.
there's more we could talk about, but we appreciate your time here today. Thank you for joining us. We look forward to the next edition of Ink Board Today.